Imagine the heartbreak of watching one of your children seize new freedom while another stands on the sidelines, denied the same chance, not by fate, but by a decision on a piece of paper. This is the emotional crossroads facing Allison Joseph and her family. A situation that's as inspiring as it is infuriating, and it challenges what we believe about fairness within our healthcare system. Allison's 9-year-old son Noah dove into the swimming pool for the very first time this summer, filled with pride and joy. For Allison, it was a moment laced with happiness and sorrow. Right beside her, her 10-year-old son Hunter could only watch, unable to join in the milestone. Both Noah and Hunter live with Duchenne Muscular Dystrophy, DMD, a severe progressive genetic condition that eats away at muscles and leaves families racing against time. The difference between the boys: Noah received a life-altering gene therapy treatment approved without trouble by insurance, while the exact same request for Hunter was denied. Hunter sees his younger brother now, doing so well and so easily playing outside, Allison shared in an interview. Of course, he wants to do all those things too. There's a sadness there. DMD primarily affects boys and causes a rapid decline in muscle strength and function, stemming from a genetic mutation that robs muscles of dystrophin, a critical protective protein. Symptoms often start with delays in crawling, walking, or talking, and steadily worsen. Most boys with DMD gradually lose the ability to walk during their teenage years and face a shortened life expectancy of just 30 to 40 years. But here's the part most people overlook. All this suffering exists even as medical breakthroughs dangle hope within reach. In March, thanks to her insurance plan, Allison managed to secure access to a groundbreaking gene therapy for Noah. This treatment, meant to boost muscle strength and give patients a better quality of life, promised a glimmer of hope. Yet, when Hunter's application was submitted just weeks later, it was unexpectedly denied, deemed not medically necessary. Allison, herself a physician, and her husband William, who works in finance, were stunned. How could two brothers with identical diagnoses receive such drastically different answers? Suddenly, they faced an agonizing, almost unthinkable choice. Blue Cross Blue Shield, their insurance provider, declined to answer detailed questions about the case publicly, citing member privacy. They did explain, vaguely, that teams of doctors and experts review requests to ensure treatments are evidence-based and in line with nationwide best practices. But, for the Joseph family, that explanation rings hollow as they watch Hunter's condition worsen every single day. Every day that passes, Hunter loses a little more muscle. The clock is ticking. It's devastating to know there's a treatment available but not accessible for him, Allison explained with raw candor. The family's journey with DMD began in 2017 after Hunter was found to have high liver enzymes, an early warning sign. Further tests confirmed the diagnosis, prompting genetic screening for his brothers, Carter and Noah. Carter was clear, but Noah too was diagnosed. It was a triple blow. Two children affected by a disease that Allison herself unknowingly carried. For years, the entire family has endured the slow-moving heartbreak of watching Hunter and Noah deteriorate, all while facing the harsh reality that no cure currently exists. But then, a sliver of optimism arrived in 2023, a new gene therapy called Elevidys, developed by Sarepta Therapeutics. The drug, which costs a staggering $3.2 million, has the potential to halt the disease's progression and restore some muscle function. Over 900 children have tried it. Yet, and this is where it gets controversial, some critics argue there simply isn't enough convincing data to prove its benefits outweigh the possible risks in the long run. Dr. Aravindan Veerapandiyan from Arkansas Children's Hospital is cautiously optimistic, noting that new gene therapies are changing the course of the disease and perhaps even reshaping the futures of young patients and their families. But skepticism still runs deep. The FDA greenlit Elevidys, use only for ambulatory children between ages 4 and 5 at first. Only later was the eligibility expanded. Further fueling debate, clinical trial watchdogs like Public Citizen have criticized the drug's approval. pointing out that trials have not clearly demonstrated long-term, meaningful improvements in patients' ability to move. The risk isn't just theoretical. Last July, the FDA even called a temporary halt to distribution after a child's death, although it was later deemed unrelated to the gene therapy. Cautious as they are about who should receive it, authorities have still forbidden its use for non-ambulatory patients. But both Noah and Hunter, for now, can still walk. For Allison and William, though, the choice was clear. They wanted to seize the best opportunity for their sons before muscle loss became irreversible. After a careful round of medical exams, the family's doctors decided that Noah, whose heart was assessed to be in better condition, would go first. The insurance company approved his treatment in November 2024, and he received Elevidys in March 2025. The results, says Allison, have been nothing short of remarkable. Noah used to be exhausted and complained of leg pain every day. Now, he's swimming. His endurance has improved, and he isn't tired in the evenings anymore. It's like he's been given a new lease on life. But while Noah flourished, Hunter was left on the outside, his health deteriorating. When the Josephs sought the same therapy for him, and both doctors and cardiologists gave their blessing, insurance unexpectedly slammed the door shut. Even worse, on closer inspection, the family discovered their insurance company had apparently amended its policy just weeks after Noah's approval, quietly excluding the very genetic mutation their boys have. Is this coincidence or something much more troubling? Allison suspects the latter, challenging whether the company deliberately changed its rules, knowing another claim was looming. The insurance company declined to address this directly. Now, Allison and William are running out of time and options. Their appeals have so far been unsuccessful. They have reached out to lawmakers at the state and federal level, enlisted the support of medical professionals, and even sought legal counsel. Still, the clock keeps ticking, and Hunter grows weaker. I feel helpless. Allison admits, we've always tried to make the best choices for our children, but now that voice, that choice, has been taken from us by bureaucracy. Every week counts for Hunter, whose best hope for a fuller life hangs in limbo. As Allison describes the heartbreaking process of simply watching her son decline, she highlights a glaring issue. This therapy could stop the disease's march. So why, with so much at stake and a precedent set by his brother, is Hunter left behind? Here's the question that's sure to divide. Should insurance providers be allowed to reverse established coverage after approval, especially when two siblings are affected in exactly the same way? Is this